Auricle coaching, that is 90-day university prof pre-final mastery course, right? You all know about it. So today's, I'm Dr. Santhosh, your microbiology educator. So we have completed mycology part 1. Now we are in mycology part 2. So what we are going to do, what is happening in Auricle, what we are doing in Auricle teaching is basically, you're going to have the rapid revision. I'm going to write it here. First of all, you're going to have a rapid revision of all important questions from all last 10 years, right? You know that one. And the volatile facts about the quick revision of all the subjects, high yield topics, and the most expected topics will be covered. Okay. And now, this is beneficial for everyone, not only for University Prof exam, for NEET exam, and also for FMG students. It's going to be amazing. Okay. So now, when you talk what we're going to discuss today in mycology 2, we are going to cover all the important topic. We have long questions, and then we're going to discuss the short questions, short essays. When you talk about long question, there is always a question on Candida albicans, on histoplasmosis, dermatophytes, cryptococcus neoform. These 4 questions, definitely you will have one question in your final, 1 or 2 questions for sure. Without this, you will not have any microbiology prof exams. Okay, so that's one thing. That's what we're going to discuss today. It's going to be very easy. And short questions is going to be germ tube test one, and the other one is the laboratory diagnosis of mother of food. Okay, that's also easy, and we will do it now. Okay, now let's go to the topic. So why to choose Auricle? You all know that, don't need to say, because we already have recorded classes. You must have seen already. It is very easy and made it so easy. In 16 hours, we have finished everything. You will enjoy the classes. It's very simple. Live classes, what we are doing now, that is for direct interaction, one-to-one interaction. And we have practical session, which is going to be more interesting because we are going to, so practically, we're going to bring all the medias or instruments, whatever in practical exam needed. And it's going to be short and sweet so that you will easily pass your practical also in a very good score. And this exam module, you know that what you're doing, and you're going to get a hard copy set also soon, right? And then so recorded class, about recorded class, no need to say. It's all about flexible learning, expert instructions you'll get in recorded classes, convenient revisions will be there, right? And then live classes, what we're doing now, you're going to have an in-depth coverage. Experienced educators, all are going to be very interactive, all are very educated educators who have very good experience in their subject. They're going to talk to you, and an interactive learning session also will be there, right? And express exam module is, that's what we're saying. So the complete syllabus, what we did is that you will complete the syllabus in 20 hours. In microbiology, it's only 16 hours, so that means we have made it everything so easy and quick that, you will answer it. And also answer writing skills, expert educators. These are for exam module. One-to-one doubt clearing session would be an awesome session. This is sort of new because you're going to have a direct, like a friendly conversation, one-to-one. So you and then one of the educators or doctors will be here, and then you can ask us, directly. We're going to discuss about this, more of your doubt without any shame and shy. You can ask, and we will clear all your doubts. Hot copy. Hard copy is important. At the end of the moment, you're not going to use your computer. You have to, in exam, you're going to write with your pen. So it's better always, in a hard copy, you can write all your points, important notes, highlight the things. It's going to be very, very useful. Okay. So we have a question bank also, 3 levels of expertise, consecutive question levels, beginners to expert level, and it's always customizable question, and questions are very, very important. If you only master these questions, you're not just passing the exam, you're going to score in a very, very good marks. Okay. And then this covers also some MCQs of Prof exam, NEET, PG, FMG. In Mycology 2, the questions will be less because we already covered in Mycology maximum questions. If you have time, we're going to discuss that also. Yes, and practical session, as I told you, in all subjects, the practical will be more to make you more confidence, in your skills. We will show directly the example in microbiological point of view, the culture medias, the biochemicals, some of the instruments which we are using, commonly used in microbiology, where during practical they will ask you. So those things will be shown for you. Okay. And then the subscription plans, we have foundation plan, we have advanced learning plan, we have complete learning, and then ultimate MBBS plan. Foundation plan is for 3 months, and the price, it's written here. It's not that expensive. And advanced learning plan 6 months you have, that also the plan prices here. 12-month plan, complete learning plan is also an awesome one, where you have to you have everything. You're going to have, main thing here is this one-to-one doubt clearing session, and hard copy things will be there in 12-month session. And all this thing, if you want for your complete MBBS, then you go for ultimate MBBS plan with this price. It is worth it. Okay. Next. Let's start the topic now. Now, the first topic is describe the morphology, pathogenicity, laboratory diagnosis of Candida albicans, right? Candida albicans. This is a question. This is what they have asked. Okay. Now let's talk about each thing. Okay. So first thing, when you talk about morphology, so the first point what you're going to write when they told you to write about morphology, remember, Candida is a yeast-like fungi. It is an yeast-like fungi, right? It is a yeast-like fungi. Yeast-like fungi. That means when you say yeast-like fungi, a true yeast, when you talk about true yeast, it should have a proper budding cell like this. But for yeast-like fungi, what happens is that this yeast cell, they produce a hyphae, but that's not a true hyphae. It is a pseudo hyphae. That's it. So when you talk about pseudo hyphae, when you talk about morphology of Candida, okay, Candida albicans, especially Candida albicans they mentioned. So any Candida, they are yeast-like fungi, they produce pseudo hyphae. That's it. The first point. This is the main point you're going to write. Okay, this thing. That's all. And draw this picture. Fine. Next, about pathogenicity. When you talk about the pathogenicity, you're going to talk about the risk factors and the diseases. You have to talk about the risk factors and the diseases. You basically know that risk factors for Candida albicans is very easy topic, and most of you must be knowing. I'm sure you know that. Okay, even if you don't know, also it's very, very simple. You shouldn't make mistake in this type of questions. So risk factors, first common one is your diabetes mellitus, diabetes mellitus. Second one is pregnant lady. Any pregnancy, Candida is very, very, very commonly you can see. Okay, pregnancy. And third one, immunocompromised state. When I talk about immunocompromised state, I'm talking about HIV patients. Okay, and extreme age, old people or the children's. When I say children, very less than 1 year, 2 year, when the immunity is not well developed. So these are the risk factors you're going to write. When you talk about the diseases, you have many diseases. Let's start from oral cavity. First of all, let's start oral. In oral, what you're expecting, when you talk about oral cavity, you talk oral or pharyngeal, no? Oropharyngeal candidates. So oropharyngeal candidiasis. Oropharyngeal candidiasis. I'll show you the picture also in a while. That's called oral thrush. Okay, oral thrush. The first one, let's go one by one. So oral thrush. Okay, and then let's go to esophagus. Esophagus, you have esophagus candidiasis. You can just write esophagus candidiasis. These candidiasis are again common most in HIV patient, but you can write it here also. It's not wrong. Okay, fine. Now, next one is asexual candidiasis. Then what else possible? In another one is in female, it is vulvovaginal. When you talk pregnancy and all, we are talking about vulvovaginal candidiasis. Vulvovaginal candidiasis. Very, very simple. Okay. So go one by one, oral, then esophagus, then vulvovaginal candidiasis, and then what else are the possible? You can say candidiasis can occur in the nail also. When it occurs in the nail, you call it as onychomycosis. Onychomycosis. It can cause the nail infection also. So in the nail, it causes onychomycosis, right? And then one more thing, don't forget genitals. In men, especially diabetic patient, usually they come with a balanitis, right? It is in the glans penis inflammation. Okay, so genitals, when talk about genitals, balanitis. So these are the common one. And again, in children, you remember diaper rash, no? Diaper rash in children. So these all are common diseases you have to mention. When they talk about pathogenicity and disease, you're going to mention all these diseases. Okay, and of course, in a complication, it's not just only these diseases. As a complication, it can cause rare, of course, not that common, meningitis, pneumonia, sepsis. Sepsis, very common these in ICU patient due to immunocompromised state. Okay, and also one more thing is pneumonia, but it is rare. Okay, it is rare because usually it is commensal. No? So we have to be careful before saying that is due to this thing. Okay, due to the any catheter involved, everything, in the ICU patient, everything, this complication, all this can happen. Okay, now this is fine. Now our most important topic here is what we are going to do, we are going to check our diagnostic part. Important part here is the diagnosis. So what we are going to do in the diagnosis, what are the important diagnosis things we have? Okay, let's write it here. Diagnosis is the most important part. First of all, in diagnosis, we are going to do, we'll start always, it's bacteria or fungi, you will start with the slide, I mean microscopy, and then go to the culture, and then extra test, whatever it comes. Okay, so when you go for microscopy, first we are going microscopy means I'm talking about the gram stain. So you do a gram stain. When you do a gram stain, you will see a gram positive budding yeast cell, BYC, budding yeast cell. Okay, a purple color budding yeast cell you will see. I'll show you the picture in a while. Okay, fine. Now, what about the next one? Before going to culture, there is one special thing for only Candida, especially Candida albicans. We call it as germ tube test. Okay, germ tube test. We're going to talk about in a while. I'll show you germ tube. This is a short note question. So I'll show you the germ tube test also in a while. Okay, the gram stain, and you do a germ tube test, which is also called Reynolds phenomena. Okay, Reynolds phenomena. It's very simple. It's just basically you add the colony in the serum of human serum or sheep serum, and then you see a tube is growing. That is called germ tube. That's it. The tube, that's called germ tube. That's it. Okay. Now, third one is your culture. So we have variety of cultures. That's what this is important. So, and this one, this germ tube is specifically positive only for Candida albicans. Though different candidates are there, so it's only for Candida albicans positive. Okay. Now, culture. In culture, what are the things we're going to do in culture? If you ask me in the culture once again. So in culture, what are the culture? First of all, standard one is sabro-dextrose agar. You know that sabro SDA media, sabro-dextrose. We in previous class we detailedly discussed about sabro-dextrose agar. Basically, pH is 5.5. This is if you want now, I'll repeat once again. pH 5.5. It has dextrose. It has the agar. Okay, that peptone agar. Dextrose is there. That's it. Basically, it inhibits the pH is this to inhibit all the bacteria. That's it. Okay. So SDA agar, you'll see what? You'll see a whitish yeast colony. White yeast colony. Yeast. White color. You know, you say it is a paste. Yeast is like a paste. So white colony you can see in SDA agar. Okay, one. Number two is your chrome agar. Number two would be your chrome agar. In chrome agar, I'll show you which is a chrome agar in a while now. Chrome agar is basically each candida produces different colors. Based on the colors, you identify the species. You identify the species. Excuse me. Identify the species. Okay, chrome agar. And then comes your next one, chrome agar. Then one more thing is a cornmeal agar. You have a cornmeal agar. Cornmeal agar, basically what we do with cornmeal agar, it is to induce the chlamydophore. Chlamydospore. This is characteristic for Candida only. C for chlamydophore, C for Candida. For that you can use. Okay, that's it. Apart from these tests, there is, apart from this grams, germ tube and culture, we can do one more test also, which is called beta glucan. Okay, beta glucan, beta D or beta whatever. Okay, glucan test like galactomannan for aspergillus. We can do beta. It's not a specific test. It's not a specific test, but it is also one of the tests for Candida. We can do. This is one of the, it's like sort of serological test, you can say. Okay, that's it. So these, apart from that, there is few other tests also, like we have sugar assimilation test also to speciate. We have sugar assimilation test. These are the tests. If you remember, if you list out these tests and write little bit about the colony, it's more than sufficient to get all the scores. Okay, now all the explanations given here, you can check here. See this? This is the picture I was saying. This is pseudo hyphae you're seeing here. We just spoke. One second. Okay, so this is the pseudo hyphae which we were talking. We just spoke. Okay, and then this is the oral thrush. This is the vulvovaginal candidiasis you're seeing. Predisposing factor we just spoke, and mucocutaneous lesion. All the vulvovaginal candidiasis I forgot to say. You'll see a curdy white or cheese-like discharge. Okay, in vaginal discharge we're going to study, but mainly in the vaginal candidiasis you're going to see curdy white discharge. Okay, don't forget that. And of course we talked about balanitis, onychopsychosis, systemic infection. So you know, smear you'll see this budding yeast cell. Germ tube Reynolds phenomena. This is what I told. This is the tube you're seeing. This is the Reynolds broad phenomena where you're seeing a germ tube. This is the germ tube. Okay, you will talk in detail in a while now. Then cornmeal agar, SD agar, chrome agar. We spoke about it. And beta D glucan assay is invasive for invasive candida infection. You can, so this is, see, you can see this is the STM media. You're seeing what? Paste, like white paste like colony. Yeast is like a paste. Okay, mold will be different. It will be brown or black, different colors. But yeast will always be like this. Even a cryptococcus looks like this only. Okay, and this is a chrome agar. In chrome agar, you can see it looks like a rangoli, different colors. So each color represent individual candida. It could be candida albicans, it could be dubliensis, different varieties we have. Parapsilosis, so many. You don't remember all those things, but you can identify candida species by this one. Okay, right. Now next one. The histoplasmosis. Histoplasmosis is another very important disease. So they ask laboratory diagnosis, but when they say laboratory diagnosis, you have to write little bit the clinical part also, right? Otherwise, it doesn't look good. First of all, the first thing which we are going to do here is we have to know the other names. Other names of all the dimorphic fungi is needed for this. First of all, it is the disease name, and then which group it belongs, and then we'll talk about the disease and the diagnosis and which disease, and then what is the risk factor, how it is coming. Okay, first of all, what is the other name? Look at this picture. If you look at this picture, I'll just show you clearly once again. You see this picture. Okay, so they are in the cave. This picture you can see, this is this boyfriend and girlfriend, husband or whatever. They are in the cave. Okay, this is a cave. Inside the cave, he is with his darling. Okay, he's with his darling. Where? In Ohio cave. It's in the Ohio. Okay, in Ohio cave. What happened? This guy, the husband is hitting in a good way. Okay, in a romantic way. He's hitting his wife in the cave. Unfortunately, in the cave, what you have? You have the bat. There was this bat. Bat was dropping this droplet, and these people ended with TB-like disease. Remember like that. Okay, they ended with TB-like disease. This much only. Okay, this is a clue. However you want to remember, no problem. Okay, now let's go to the disease. So what is the other name now? I already gave by the picture only, you must have already understood. I meant to say that other name of this disease called Ohio. Oh, it's a Ohio fever, Ohio Valley, whatever you can say. Okay, Ohio disease means it's common in Ohio. Darling disease, other name is darling disease, also called caves disease. No, caves, it's a caveman. Remember like that, caves disease. So Ohio disease, Mississippi also sometimes they say, but remember Ohio, darling, and caves. That is these disease name you should remember. Okay, fine. That's important. And which group this histoplasm, which belongs to dimorphic fungi? We talked about in last class, dimorphic fungi. Whenever talk about dimorphic fungi, what are the things you remember? All the bad things. Hit, blast, spot, cock, paracock, pen, right? That is the short group. So it belongs to dimorphic fungi you're going to write. And what is the risk factor? It is usually the bad droplets. Usually it is the bad droplets. Okay, bad droplets is the main risk factor. Any bird, but usually bad. The disease which is causing the disease, this is the histoplasmosis. This disease histoplasmosis. It is the causative agent. The causative agent is, first of all, it is caused by Histoplasma capsulatum. It is caused by Histoplasma capsulatum. Okay, capsulatum. The disease is very similar to tuberculosis. TB. It's very similar to tuberculosis. That means the patient will have what? Cough, sputum, fever, weight loss symptoms. Same symptoms will be there. And this is the only disease that is endemic in India. We don't see other dimorphic things. This is the only endemic. Histoplasmosis is the only endemic in India. Rest all others are not that common in India. That's also important point. Okay, similar to TB. Now for us important is the diagnostic part. Now we're going to talk about the diagnostic part. Yes, in diagnosis, one second. Yeah. So what you're going to do in the diagnosis? In diagnosis, first thing for any dimorphic fungi, what you do, the specimen, you will be doing two things. It will grow. One, you will grow in a yeast form, and other one is your mold form. Okay, yeast and the mold form. Okay, yeast form and mold form. Whenever you grow, you will get two forms. So yeast form here would be all the yeast cells are usually here it is intracellular. How does it look? I'll show you. There's a picture also back, but then it's better. I'll show you now. So it will be inside the macrophage cell like this, small, tiny budding yeast cells. Tiny budding yeast cells, narrow based. We call it as narrow based because in blastomycosis it is broad based. In blasto it looks like 8. Okay, in the blasto, that is in the blasto. in the blastomycosis. But here it will be looking narrow like this, small intracellular. The word is very important. You should write it intracellular tiny budding yeast cell. You're right. Okay. Second one, mold. See, I told the disease looks like TB. The mold is also the shape of tuberculate. You call it as tuberculate. You see tuberculate macroconidias. Tuberculate macroconidias. I'll show you the picture. You have to draw the picture. It will be like this. If this is this fungi, you'll see all this, tuberculate form like this. Beautiful tuberculate form. You draw the picture like this. That's more than enough. Here you will draw a macrophagic cell, intracellular inside a macrophage. You tiny budding yeast cells like this. Okay, enough. Here you write a tuberculate. This is if you write more than enough. Treatment is amphotericin B. Very, very easy and simple, right? You don't have to confuse. Everything is written here. You can check here. Histoplasmosis is called Darling disease, cave disease, Ohio disease. We discussed just now Histoplasma capsulatum, inhalation through the birch dropping, mimic TB, mold is tuberculate, another one is narrow, tiny yeast cell inside the macrophage. This is the yeast form, and this is your mold form. Okay, finished. Very, very simple. See, you would have easily scored. If you know this one, easily you will get scored. Okay. Now, what is the classification laboratory dermatophytes? First of all, dermatophytes classification we will before going. Yes, we will talk one by one. First diseases, and then we'll go to the when you talk about dermatophytes, we usually talk about which disease. So first of all, we'll write about the other names. Okay, let's start with the other names. Okay, yeah, so first we'll go to the other names, and then we'll talk about the etiological agents. Okay, and then we'll talk about the different diseases. What are the different diseases? Okay, now what is the other name? Other names are, we're going to talk in a while now. Yes, other name, this is also called as, tinea. Tinea infection or ringworm infection. Tinea or ringworm infections. They usually cause what? Superficial skin infections. Superficial skin infection. You would have seen, no, everyone we get during the summers, we get this round that itching wala, no. So highly pruritic skin infection. Okay, that is the one, tinea infection. Okay, now etiology. Talk about etiology. Three things you have to remember. Dermatophytes include three things. What are they? Usually, it's very, very important. In MCQ also they ask. In MCQ also they can ask you, and here also. Okay, now etiology. First of all, trichophyton. Next is microsporum. Then epidermophyton. Okay. Trichophyton, microsporum, epidermophyton. Each thing affects individual different things. So what are those different things we are going to say now? Trichophyton 3. So it means it affects the skin, nail, and the hair. Skin, nail, and the hair. Okay, skin, hair, and nail. Microsporum means microsporum. Here you have a clue already. Microsporum. Micro hair. Remember, like micro hair. So it will be only skin and hair. This is a very, very important objective question also. Okay, please remember in the previous I asked. So here also they will ask you. You should be very thorough with this one. Okay. Yeah. And epidermophyton, again, skin is common for all. Here, no hair. Instead of what, you have epidermophyton N. It ends with N. So it is nail. This you have to write. This if you write, you'll get a good score. With 10 mark question for this part itself, they'll give you 3 or 4 marks easily. Okay, examiners will give. Okay, now diseases. Diseases, we have different type, we can say. What are they? First of all, you have to list it. Tinea capitis. Number 1. And number 2 will be Tinea corporis. Tinea capitis, Tinea corporis. Then next page. Okay, Tinea corporis, Tinea capitis. Yes, and then what else we have? So we'll come Tinea capitis, head, body, and then beard part. So Tinea barbae, and then comes your Tinea corporis over, then Tinea your fingers, unguium. A finger, then the in your leg also, no, foot. So Tinea pedis, Tinea unguium, Tinea pedis. Okay, and then Tinea cruris. cruris. Okay, inguinal region, tinea cruris. Okay, these are the common ones. Okay, we are going to now say all the diseases in the explaining in a different full manner. So now look at this. So tinea capitis, it's affecting the head, scalp. And when I say head, it is scalp. Okay, it's a scalp. So here you should know two things are important. Normally tinea capitis, but you see this picture. If you see this picture, there are two things, two conditions you have to mention. This white color flakes which you're seeing, that is called flavus. Another condition, this swelling is called chorion. Okay, so this flavus is this white flaky substance, this white dandruff or flakes is called flavus. Chorion is boggy swelling. You call it as boggy swelling. Now, why did I put these people, Sonali Bentre and our Virat Kohli? So there is a clue for you. I'll tell you why. What clue is it? So here I'll tell you. Yes, yeah. Okay, so remember this white, for this white one, the causative organism is, if you guys know it, that's very good. This is flowers is caused by your trichophyton Schonlini, Schonleni, Schonlini, Shonali Bentre. It sounds very much like a Shonali Bentre, Schonlini. Okay. Here Virat we usually call Viru, no? Viru we call Viru. So chorion is caused by trichophyton verrucosum. Trichophyton verrucosum. You have a question, objective, one mark question. Where am I marking Q? One mark. That's what I'm writing it. Okay, boggy swelling flowers. They're complication of capitis only, nothing much. Okay, very simple. When you tinea corporis, it is body. When you talk about tinea corporis, it's about the body. It's in the infections in the body. Barbe means in the beard. The name itself says barbe. So beard. Ungu means finger. Ungli, no? You remember in Hindi they say ungli means finger, no? So finger, simple. And pedis is the in the legs. So this is usually called as what? Athletic foot. It's called athletic foot. No itching, severe itching in the foot, wearing shoes, sports person, sweating, they get it, right? Cruris, it's called itch dog. Itch, which called dirty itch. Dirty itch, no? Because of the underwear in the inguinal region, we get the itching. That is tinea cruris. Okay, that's it. Very, very simple. This much you write about the disease. Then for lab diagnosis, for diagnostic purpose, what I'm going to do is follow back. Come to this picture. It's better by the picture. Oh no, you have to draw this picture. Look at this. So when you have to differentiate this one, when you have to differentiate it like this down. Yes, look at this. Trichophyton epidermomicrosporon. What you do, you are making a smear. I have made a microscopy. In microscopy, I'm going to do a LPCB. LPCB is lactophenol cotton blue. For all the fungal, for doing microscopy, the best stain is this. It will look blue color, lactophenol cotton blue. So this looks like a blue color like this. So remember, in trichophyton, epidermophyton, and microsporon. Let me change the color. Yes. So in this one, trichophyton, you remember microconodia is abundant, but microconodia is less or few in micro. In micro, there is no micro. Remember, in micro, no microconodia. In micro, there is no microconodia. Only the big guy, trichophyton, which has all the three affecting, that one is having everything. This is one point. Now, when you talk about the macroconodia, you always remember like this. This is very, very important one more question. In FMG also, in your NEET PG also, everywhere I'm seeing, they always ask. In AIMS, INICT, everywhere they ask. So what about macroconodia? When you talk about trichophyton, see how to remember, always try to write in pencil first, not in pen. Okay, you always try to write in pencil first. So you see all the small pencil tip, no, pencil shaped macroconidias. What about epidermophyton? Epidermophyton, you remember very commonly whenever in South India you go, usually the guy's name Ebi, these are the club owners. Okay. So remember like that, Ebi is a club owner. One more club is that will come in your club shaped spores you will see in the Clostridium perfringens. That is our Nagarjun story. We'll stock in that in the bacteriology, we'll study it very easy. Another, remember, every Ebi owns a club. That's it. Otherwise, if you remember with mnemonic, it's totally fine, but many people have problem with the mnemonic. So don't confuse. Easy remember. Try with pencil. Try epi. All the epi has a club. Microsporum, already there's a clue. Microsporum, microspindle. Okay, in micro we spindle everything. In micro we spindle everything. So spindle shape. It's like this. The picture is down. You can see this picture. This one. See, this is a club shape. This is all club shape. This is pencil, and this one is spindle. You see, it looks spindle like this spindle, right? Spindle. That's it. Okay, finish. So this, if you write, the examiner will be very happy to give you full score, good score. Okay, right. Now next one. Now the cryptococcus, the biggest one. Yeah, it's not that biggest one. It is one of the commonly asked expected questions only, cryptococcus neoformans. So first of all, the morphology, and then culture characteristics, and then the lab diagnosis. Morphology, when you talk about the morphology, let me put this morphology, and then we'll talk a little bit about the disease, and then the lab diagnosis. Okay, when you talk about cryptococcosis, the first thing you should remember before going that, let me just go one by one. Yeah. So, what are the things you should remember? Morphology is a true yeast. This is one of the true yeast. This is the only true yeast I would say. One more Saccharomyces is not important. So, the true yeast is this. True yeast means they truly form a budding yeast cell. You see the cell and a budding yeast cell. So, you see a budding yeast cell and white color colony candida. That's what it's called, true yeast. Okay, one more thing. What's other important? It has a capsule. This is the only capsulated. There are a few more, but mainly for MBBS exams, you have to remember only this cryptococcus. Though histoplasma capsulatum is called capsulatum, but there is no capsule. But in cryptococcus, you have a capsule. That's what it is. It's a capsulated organism. Okay, please remember one. And then of course it produces melanin pigment. Okay, extra. And then one more is urease positive. These are the three important factors for extra scoring. Yeah, but true is, you must remember, capsulated melanin urease is an objective in upcoming exams, NEET, PGs, they can ask you. Okay, that's it. Now the disease. How this disease is, what disease is caused? Before that, the disease is spread through which one? You remember, cryptococcus is very common in the HIV patient. So it is pigeon droplet. Bat is for histoplasma. Hit the darling in the cave. In the cave, what lives? Bat lives. But here in Cryptococcus neoformans, it is the pigeon. Okay, it's a pigeon. Remember, pigeon droplets. Pigeon droplets, very important. So remember what happened. Who is the risk factor here? Mostly HIV patient. HIV patient with a CD4 less than 200 is the highest risk. Okay, in CD200, other important infections, Toxoplasma gondii and pneumocystis there obviously. Pneumocystis also is a fungal. One more issue of this one. When a CD4 count goes less than 200, you have to write this. Very, very important. And usually the primary infection is always pulmonary infection. It's looking like it will look like a TB, pulmonary infection. Okay, and if you remember, both Candida and Cryptococcus cause opportunistic infection. That's what we say. It is in immunocompromised patients, especially HIV patient. It's common. It can occur anywhere, but HIV is common. And then complication, it leads to what? Which leads to one of the most important complication HIV patient, meningitis. Meningitis is the most common cause of meningitis in HIV patient. Most common cause of meningitis in the HIV patient, AIDS patient. Okay, remember that is another very, very important point. You will not forget. Okay, finish. So this is your clinical feature. Very easy. Nothing much to know. It's very simple. You would never ever forget it. Cryptococcus one, crypto, candida, the histono, like chocolate type of questions. You cannot mistake. That's what I'm saying. More interaction, more live classes, more interaction, and final revision also we are going to do, then you will be like expert in this. Okay, now lab diagnosis. As I said, you always do go with microscopy first. When you say microscopy, here, because there's a capsule, not only normal microscopy, you have to check for the capsule. You have to do some staining for special staining for capsule also. And about culture, when you come for the culture, we have, what are the cultures we can do? We do SDA culture, and we have a special culture. This is a bird, no? So remember, bird seed agar. Bird seed agar, or Niger seed blackbird. Niger seed agar, blackbird. So Niger seed agar, remember like that. Black pigeon or Niger seed, whatever, however you want to remember. Okay, these are the important things you're going to do. And then the best test, we have the best test. Best rapid test, okay, which is the best rapid test. So this much you have to explain. So what are the things you're going to say now? So when I say, when I talk about, change the color, microscopy, you do first thing what you do a gram stain. When you see a gram stain, you will be seeing a beautiful budding yeast cell. Oh, it is in candida it's oval, here it is more round. Okay, round budding yeast cells, round budding yeast cell. You can draw the picture like this also and show. Okay, with capsule sometimes visible. You can see the capsule also with capsule. Okay, round budding easel with capsule. Don't forget, that's very important. And when you talk about the capsule, which stain you're going to do? Indian ink negative stain. Basically, you do negative stain. You do negative stain. And what are the negative stains? You know, Indian ink and the nigrosin. Indian ink and the nigrosin. NIG-ROS nigrosin. You know, capsule means Indian ink and nigrosin. You have to do. STA media, we just told it is a yeast. So it just looks like a white color, white paste-like colony. So you remember white mucoid colony. White mucoid because anywhere there's a capsule, there's a mucoid. White mucoid paste-like colony. It's a paste-like colony. Pasty colony. Same like your candida. The CC, both CCs have this type of thing. Okay, you wrote it. And what about the bird seed and Niger seed agar? When you talk about the bird seed and Niger seed agar, you will see already the bird Niger is a black color. So your colony will be brown. I'll show you the picture in a while. Brown or black color colony. Brown or black color colony. Brown or black color colony. Now that's fine. Now the best test. This all anything can be your 1 mark objective questions also. PG and Gauge and everything. So crypto is one question, examiner's favorite question where to ask the MCQs. Okay, so please remember that. Which is the best test you're going to do? You're going to simple card test. That is your lot of things you can remember. Latex agglutination you can do, or you can do a simple immunochromatographic test, ICT, immunochromatographic test. That is the best test. They are the rapid tests. They are rapid test or gold standard rapid test, whatever you want, you can say. Okay, now I'll show you the picture. Come here. Now, if you see, look at this. This is your negative stain. You did a negative stain and you're seeing this beautiful capsule is visible. This white color one, what you're seeing, that is the capsule. Okay, that is the capsule. So negative stain you're doing and then you're looking for a capsule. Okay, fine, very good. Look at this. This is this brown color. This is the bird seed and Niger seed. You see the brown color colonies. Brown, or black, brown, black colonies you see. Okay. Now, apart from that, yeah, one thing I didn't say you. So everything we have covered, meningitis, white colony, black colony, India ink. Okay. And then if biopsy is done, this is the one. You use the mucicarmine. This is for tissue, inside tissue. You know, like in brain, if it affects the brain or lung or whatever, you take them, see, you can see this budding is inside the tissue. You can see this one. Okay, that you remember. Okay, brown, black or mucicarmine stain. Okay, it's for biopsy stain. Done. And then, of course, the best test, gold standard test would be your latex agglutination test. The best test. Okay, that's it. So we're done with this. Now we're coming to a small question. Okay, very simple question. Germ tube test. Just now we spoke. Otherwise called Reynolds-Brown phenomenon. When they ask this question, germ tube test is specific for only Candida albicans. Candida albicans. See, there is one more species, but I don't think so. They will expect MBBS students to know. But there's one more species also, Candida dubliensis. Dubliensis also. But you remember Candida albicans, that's enough. It's positive only for Candida albicans. Okay, first thing. Now, method, how to do this germ tube test. Very, very simple. What you're going to do is you are going to take a what you're going to do is that you take the colony, whatever the colony grown, okay, Candida colony you pick, the white color colony from STA media, no, any media. So from STA media, you take the colony and mix with what? Mix with which one? Your serum. Which serum? A serum can be human serum or a sheep serum, any serum. You take the blood. Usually in a lab you'll get it, human or sheep serum. Okay, you mix it and then put it in an incubator, okay, and incubate it for 2 hours, 2 to 4 hours. Sometimes 2 hours is sufficient, but sometimes 2 to 4 hours is fine. And then you do the microscopy, and then you check the microscopy. What you see? You will see a tube-like projections. Tube-like projections. And that tube should be, when this is like this, you will see projection like this. That means you should explain that there is no constriction. This is basically a hyphae. No, this is basically a hyphae which is growing outside. That's called tube-like projection. So there should not be any constriction. That is the main thing. If you have a constriction, then that is pseudo hyphae. That is common one. That is common for all Candida. So this shouldn't be there. So there should not be any, at the origin of the tube, there should not be any constriction. That's it. This you right. This is otherwise also called Reynolds-Brody phenomena. Reynolds-Brody phenomena. You will definitely have an one more question here also. I didn't write question this time because everything here is an important question. So if you are revising, please remember in upcoming we will have more question discussion. But yeah, please remember Reynolds-Brody phenomena, germ tube test. That's it. Okay. This is only. So now we're coming to the last question. This is we have written everything. You can see this. Now the last question, which is a mother of it. Okay. Now we talk about the mother of it. When we talk about the mother of it, what we're going to discuss is here. Yes, the other name for mother of it. Okay, first I'm going to differentiate, write it here. Yeah. Yes. When you talk about the mother of it, it's also called mycetoma. You call mycetoma or Madurafi because at first it was discovered in Madurai in South India in my place Madurai in Tamil Nadu. They have in Madurai they found this one mycetoma or Madurafi from Tamil Nadu only. Okay, it was isolated there. Now, what are the classic signs? That is important. The classic symptom. The classic symptom. Before going to causative agent, we'll do the classic symptom, then we'll go to the causative agent. So you have tried the classic symptom or clinical feature. The picture itself, the picture here itself, it shows, so everything is here. So let me change the color. First classic symptom, and then we'll go to the next one. So when I'm going to write the classic symptom here, what are the classic symptoms? First of all, see, there is a swelling. You will have a swelling. When they get mother feet, there'll be swelling. Swelling plus there will be lot of this. There's a sinus cavity will be there. There is sinus cavity, and with sinus cavity, you can usually discharge will be there. Okay, here it's not given, so you will have a discharge. In this discharge, what is characteristic? You will see granules, granular discharge. That's very, very characteristic. Granular discharge. This is also question. Okay, granular swelling, sinus, discharge. Swelling, sinus, discharge. Very, very simple. Okay, this is picture automatically will come in your mind. So many times they go to surgery only. Surgery people only will try to dissect and remove all the pus and they send us a sample and we do it. So now we have to do a lab diagnosis. So before going to lab diagnosis, let's now do causative agent, the differences. Okay, so we are going to write the types now. Types, if you say for mycetoma, we have two things. One is actinomycetoma, actinomycetoma, and other one is eumycetoma. Okay, actinomycetoma and eumycetoma. Now what we have to do is the differences. Now for the differences, once again. Yes. Actinomyces. So A for after A comes B, right? After A comes B. So this is caused by bacteria. This is usually caused by bacteria. Which are the two bacteria? One is your actinomyces, the filament forming gram-positive bacteria. We'll talk in bacteria, don't worry. Actinomyces and nocardia. The two filament forming beautiful bacteria form actinomycetoma. After E comes Hef, right? So eumycetoma is usually caused by fungi. In fungi, there are many species, but this Madurella is one of the classic example. Madurella. Okay, Madurella. So remember that one. Okay, Madurella. Madurella here actinomyces and nocardia. Here Madurella. First causative agent. Now what happened? Swelling is common in both sinus. In bacteria, there will be multiple sinus. There will be multiple sinus. Whereas in eumycetoma, you will have very few sinus. Fungi, few. F for F, few fungi, few sinus. Okay, another difference. Third one, the granules, whatever you're seeing. So sinus you have to explain, and then you have to granules you're going to explain. For granules, color in bacteria would be yellowish, white to yellow. Usually yellowish is good. But fungi, anywhere, if you say fungi, black only. From COVID time, we know. Whenever there's a mucormycosis, aspergillus, black. So remember like that, whenever fungi comes, it is usually black color. This is the difference. And of course, when you talk about the treatment for actinomycoma, you go with antibiotics. You do antibiotics. For this one, for your eumycetoma, what you do, you have to do surgery first, followed by antifungal. But surgery is the main thing here because it will not easily destroyed by antifungal drugs. Okay, so that's one thing, right? Okay, now, yes, I should have written here. Now for diagnostic part, I'm going to rub this and write it again. Okay, so once again, yeah. So I'm going to erase all the ink. Now I'm going to write the diagnostic part. Laboratory diagnosis, what you do, first thing, sample is the granules. What they give you, the surgeons, what they do, they take this granules in a cotton gauze base and they send it to us, right? The samples are granules from the discharge. So what you have to do, these granules, this is important. The granules, you have to take a glass slide, you take a two glass slide, put this granules inside, crush between the two slides, you crush it. After crushing, you do many things. What you can do, first thing, the granules ka, you can do a gram stain. You have to do first thing is a gram stain and an acid fast stain. Acid fast, gram stain and acid fast stain. And you do a KOH. Okay. Okay, I'll tell you why. Do this. And then second one, what you do is that this granules, you after the staining, of course, you send it for culture. Very simple. You do for culture for both bacterial culture, fungal culture. Fungal means usually we talk about STA, okay? Fungal culture, you send it. Now, why to do grams and acid fast stain? I'll tell you, because it can be both. We just spoke that it can be both, right? We told that it can be bacterial or fungi. So gram stain is for bacteria. And acid fast also because especially when you're thinking about nocardia. Both actinomyces, nocardia in gram itself will find. But again, to differentiate, you have to do nocardia. Nocardia is an acid-fast bacteria. We'll talk more in bacteria. Don't worry. That's my responsibility to make it very easy. Now remember this. Okay. KOH to see what? It's a fungus. If it is a fungus, if it's a modurella, we can see the hyphase. No, fungal hyphase we can see. So for that, you're doing a KOH. And culture, bacteria culture, and usually fungal culture, STA, bacterial culture, any bacterial culture. We have so many McConkey and blood agar, so many anaerobic culture, so many things are there. So remember this much only. So this is the laboratory diagnosis for the main thing. They would expect you to see the granule and crush it. Also, granules macroscopic is important. Macroscopically, based on the color, I told you, based on the color, you can identify bacteria. So that's one of the differences. So based on the color, size, you can differentiate it. But main thing is that you're going to do a microscopy, that is doing a gram stain and acid fast stain and culture. Every fungus and bacteria, don't forget two things you are going to do. One is a microscopy, you stain the smear and see it. And other one is your culture. That is the common for all the bacteria and fungal. One of the common features we are going to do for everything. Okay, so that's all we have did it. Okay, now so I didn't write the questions here, so I might ask you one question now, so you can answer. I haven't write. Okay, I will. Okay, this is fine. Okay, so I'll only verbally ask. You can answer. Okay, which of the following dermatophyte affect only skin and nail? Okay, only skin and nail. Options are epidermophyton, microsporum, trichophyton, and trichosporum also, if you remember. You can answer me. Okay. Options. Okay, skin and nail. Options are epidermophyton, trichophyton, and microsporum and trichosporum. Which one you think? If you say epidermophyton, you're right. Okay, because epidermis is skin plus N is there, so nail. So that is okay. That's one question definitely expected. And then other one is, which is the capsulated fungi? Which is the capsulated fungi? Options: Candida, Histoplasma capsulatum, Cryptococcus neoformans, Actinomycetoma. So if you say Cryptococcus neoformans, it is right. But many people, students, they will see Histoplasma capsulatum and they very happily mark. But that's not a true capsule. That is a pseudo capsule. So only Cryptococcus neoformans is the right one. Okay, fine. That is one question. Okay, right. So if you're saying that answer is fine. So these are the things we have discussed today. So now it's time to say thank you. So once again, this is all the pictures. Okay, you can see everything. One more thing I forgot is in mycetoma, you can do, one second, you can do a histopathological stain. That is, apart from the mucicarmine and other thing, you can do this hematoxin eosin stain. You can do. When you do, you will see this typical granulomatous reaction with the bacteria or fungus, whatever around it. Okay, so just one more extra point. That's it. Okay, rest all whatever discussed is here. If I missed also, you can read this slide. Same thing, whatever discussed. At end of that discussion, we have written it also in a word so that you can read it. Okay, so thank you so much. Thank you for watching. So once again, we remind you, this is very Oracle is very important. You can use my code also if you want some benefits. I was showing in all the slides. If you see my previous, there is a code. Use this code Dr. Santhosh Rajan 20 here for special discount. You will get, okay? Surely you'll get it. Dr. Santhosh Rajan 20 is for Descript 1 subscription. Okay, fine. So thank you once again. Choose the right thing. Do well. I'm sure your medicine subject will be very easy with the Oracle. Okay. So once again, welcome. If you have joined, it's very good. If you haven't joined, you see, check it out and join. I'm sure we guarantee that you will have very good upcoming classes. Will be more interesting and more easier way that you will do very well. You'll perform very well. Okay. Thank you so much.